U.S. Senator Marsha Blackburn was in Chattanooga to talk about her rural health agenda. It's a bipartisan set of bills to expand access to health care in rural areas. Liam Collins talked to her about that today. Liam, tell us what she said.
Yes, Cindy, she expressed some concern about where Tennessee stands in relation to the rest of the country when it comes to rural health care access. Hundreds of rural hospitals are close to closing down today, and that's the problem a group of bipartisan senators are hoping to solve. More and more rural Tennessee hospitals are on life support every day. Hundreds have closed or have gotten closer to closing every year since 2005. The National Center for Healthcare Quality ranks the volunteer state near the top for hospitals at immediate risk of closing.
In rural areas, it has been very difficult to keep and to retain staff.
U.S. Senator Marsha Blackburn spoke to her part in the rural health agenda in Chattanooga Friday. It's a proposal of 3 bills supported by a bipartisan group of senators, including Georgia's Democratic Senator Raphael Warnock.
Some of our areas have lost hospitals, and there needs to be a way for them to have access to emergency help.
The bills would use grants to allow rural hospitals to expand their resources. They would also expand what's called the Medicare Area Wage Index, which is used to calculate reimbursements for Medicare services, a major hurdle for rural providers.
They're not on par on reimbursements with urban centers, but yet their needs are as great.
If passed, the bills would completely forgive student loans for healthcare leaders who practice in rural areas for 5 years. Blackburn says that could solve a staffing shortage of nurses, practitioners, and other positions. That shortage was exacerbated by the pandemic when 22% of hospitals reported critical staffing shortages, and hospitals have had a hard time recovering since then. Blackburn says the proposal's aim is to strengthen hospitals and practices where access to services has struggles.
What follows that is growth in population, economic development, and economic growth.
Now, all of these bills would, of course, have to pass both the House and the Senate and be signed by President Biden in order to become law. But because of that support across the aisle, Blackburn says she thinks there's a pretty good chance that that may happen. Cindy.